For more videos, please subscribe Zoology Tutorial. Thyroid gland. Next gland, thyroid gland. So in this thyroid gland contain two lobes. Thyroid gland contain two lobes. These two lobes present in either side of the trachea. Thyroid gland. It contain two lobes. It contain two lobes. Thyroid gland contain two lobes. These two lobes location, they are located in either side of trachea. They are present in either side of trachea. It is present in either side of trachea. So thyroid gland contain two lobes. These two lobes present in either side of trachea, means the trachea left side one lobe, right side one lobe is present. These two lobes are interconnected by the connective tissue, that is called as isthmus. Two lobes interconnected by isthmus. The two lobes are interconnected by the isthmus. So they are the one connective tissue. The two lobes are, these are the thyroid gland. So in this thyroid gland contain two lobes, left side one lobe, right side one lobe. These two lobes are interconnected by the isthmus. This one is the isthmus. The two lobes are interconnected by the isthmus. Next one, the thyroid gland is composed of follicles and stromal tissue. Follicles and stromal tissue. Follicles and stromal tissue. The thyroid gland contain follicles and stromal tissue. Follicles and stromal tissue. The thyroid gland contain follicles and stromal tissue. The follicles contain follicular cells. Follicles contain follicular cells. The thyroid gland contain follicles and stromal tissue. The follicles contain follicular cells. So in this follicular cells, secretion of two types of hormones. Follicular cells, its secretion of two types of hormones. Follicular cells secretion of two types of hormones. One is the tetraiodothyroxine. One is the tetraiodothyronine or thyroxine. T4. Next, second one is the triiodothyronine. These are called as T3. Totally, the follicular cells secretion of two types of hormones. One is the tetraiodothyronine. This is also called as thyroxine, also called as T4 hormone. Next, second hormone is the triiodothyronine. This hormone is called as T3 hormone. So, these are the thyroid gland secretion of these two types of hormones. These hormones functions. These thyroid gland functions. So, in this thyroid gland function, they are the regulation of basal metabolic rate. Regulation of basal metabolic rate. BMR. Regulation of basal metabolic rate. And also it helps into the production of RBC. It helps into the production of RBC. and also helps into the metabolism of carbohydrates, proteins and fats. Carbohydrate metabolism, proteins metabolism and fats metabolism. And this also regulation of they maintain the water and electrolyte balance, maintain water and electrolyte balance, they maintain the water and electrolyte balance. So these are the main functions. And also this thyroid gland, they are releasing the another one hormone TCT, the secretion of another one hormone TCT, thyrocalcitonin. Hormone thyrocalcitonin. This hormone thyrocalcitonin function, these are the maintain the blood calcium levels, maintain blood calcium levels, So thyroid gland, they are releasing another one hormone TCT, thyrocalcitonin. These hormone function, that maintain the blood calcium levels. Next one, this thyroid gland iodine. So iodine is the regulation of iodine. So this iodine is essential for the normal secretion of the thyroid hormones. Iodine essential for normal secretion of thyroid hormones. Deficiency of iodine. Deficiency of iodine in our diet. It results hypothyroidism. Deficiency of iodine in our diet, it leads to hypothyroidism. Hypothyroidism means less secretion of thyroid hormones. Hypothyroidism means less secretion of thyroid hormones. Less secretion of thyroid hormones. Hypothyroidism. In these symptoms, enlargement of thyroid gland, enlargement of thyroid, enlargement of thyroid gland. So enlargement of thyroid gland means these are the goiter. The disease is called as goiter. So deficiency of iodine in our diet, it leads to hypothyroidism. Hypothyroidism means less secretion of thyroid hormones. This time enlargement of the thyroid gland. So the enlargement of thyroid gland, that condition is called as goiter. Simple goiter. So these are the one. Next one, hypothyroidism. Pregnant women, hypothyroidism. Pregnant women, hypothyroidism. So in this pregnant woman is a hypothyroidism. This time pregnant woman is a hypothyroidism. This time growing baby's effect inside the mother uterus, the baby is grown. The growing baby is effect. Pregnant woman hypothyroidism. Effect of growing baby. So inside the mother uterus the baby is affecting. These symptoms, one is the stunted growth, the baby stunted growth, stunted growth, stunted growth. Stunted growth means slow growth. They are called cretinism. Cretinism. They are called a cretinism. So stunted growth. Next one, mental retardation. Mental retardation. Mental retardation means they are the abnormal mental condition. Next one, low IQ. Low IQ. Next one, abnormal skin. Abnormal skin. Abnormal skin. Deaf mutism. Deep mutism. So deep mutism means there is no auditory function, no talking. There is no auditory function, no listening, no talking. These are the pregnant women. They are the hypothyroidism. Pregnant women, they are affecting of the thyroid. They are babies effect inside the uterus. The baby is effect. The baby affecting symptoms: stunted growth, mental retardation, low IQ, abnormal skin, deep mutism. So they are the inside the baby is affecting. So they are the pregnant women. Another one is the adult women hypothyroidism. Adult women hypothyroidism. Adult women hypothyroidism. So adult women is hypothyroidism. They are affecting of irregular menstrual cycle. Irregular menstrual cycle. Irregular menstrual cycle. So these are the hypothyroidism. So hypothyroidism, they are enlargement of the thyroid gland. They are called as goiter. So in this pregnant woman hypothyroidism, the baby is affecting. Inside the baby is affecting. And adult woman is hypothyroidism. So they are the irregular menstrual cycle. So they are the hypothyroidism. Next one, hyperthyroidism means the thyroid gland formation of cancer. Cancer effect due to cancer effect. Due to cancer of thyroid gland. Due to the cancer of thyroid gland or due to the nodules formation. Nodules formed in thyroid gland. Thyroid gland, it leads to hypersecretion. It leads to hypersecretion. It leads to hypersecretion. Hypersecretion means more secretion. So the thyroid gland, the formation of the cancer, or inside the thyroid gland the nodules are formation. That time there more secretion of thyroid hormones. That is called hypersecretion of thyroid hormones. Hypothyroidism. That is the condition is called hypothyroidism. Hypothyroidism. So in this hypothyroidism symptoms, they also called as exothalamic goiter. So they are the enlargement of thyroid gland, enlargement of thyroid gland, enlargement of thyroid gland, enlargement of the thyroid gland. They are called exothalamic goiter. These are called exothalamic goiter. Exothalamic goiter. So in this exothalamic goiter, so they are the symptoms. Exothalamic goiter, enlargement of the thyroid gland, enlargement of thyroid gland. Next one is protrusion of eyeball. Protrusion of eyeball means the eyeball size are increases. Eyeball sizes are increases. Protrusion of eyeballs. Next one, increasing basal metabolic rate. Increasing the basal metabolic rate. Another one is the loss of body weight. Loss of body weight. Loss of the body weight. This is also called as Graves' disease. It is also called as Graves' disease. It is also called Graves' disease. So they are the hypersecretion. So the hypersecretion they cause into the exothalamic goiter. Exothalamic goiter means enlargement of the thyroid gland. Next one is the protrusion of eyeballs. Protrusion of eyeballs. Next one is the increasing the basal metabolic rate. Next one is the loss of body weight. Loss of the body weight. These conditions also called as Graves' disease. So these are the thyroid gland.